Which of the following is a common risk factor for this patient's condition? A 45-year-old woman presents with a long-standing history of chronic sinusitis, nasal congestion, and anosmia. She has tried multiple medications without significant relief. On physical examination, her nasal mucosa is pale and boggy, and her nasal turbinates are enlarged. A CT scan of her sinuses reveal the presence of multiple bilateral polypoid masses. What is the most likely? Which of the following is a common risk factor for this? Um, Nasal congestion. I don't even know what the diagnosis would be here. I guess you could just say like you said, she has chronic sinusitis, nasal congestion, anosmia. So she can't smell. I remember you telling me if you have nasal turbinates, you kind of think rather like allergic. I forget if it was like aspirin induced something rhinitis or like cystic fibrosis.
Hmm.
I think that maybe that was wrong, but anyway, dude, frick. I
Yeah, you
would
got this. I believe it. You got it.
There's three, I mean, really three answers are decent to me. Um, I don't think nasal trauma. I don't think nasal foreign body. So it's
Okay.
rhinitis, cigarette smoking, or viral upper respiratory infection. Um, Viral upper respiratory, maybe. Allergic rhinitis, or cigarette smoking. My brain wants me to pick cigarette smoking just because I don't know, and that's just like the most probable answer.
Okay.
Um, I don't, I don't know. I'd probably go with that. I don't know.
Okay. It's actually allergic rhinitis, and we'll talk
I
about
was
that.
leaning towards that one too. Dang it. Okay.
Yeah. So let's talk about that. So, smoking is always a risk factor for almost everything, right? And so, smoking ironically can flare up allergies, right? Because obviously smoke has so many things in it that people are allergic to, right? But right, the key thing is if you work through this woman, right? She's a middle-aged woman. They already told you that she has chronic sinusitis, she has nasal congestion, she can't smell. Okay. She's tried multiple medications, no, it doesn't help. And then her nasal mucosa pale and boggy. That's one thing to say that she has an allergic mucosa. Okay,
Mm.
so your mucosa turns pale and boggy when there's a lot of inflammation, especially with allergies. And then her nasal turbinates are enlarged. Anytime you see nasal turbinates enlarged, you got to be thinking of allergies or allergic rhinitis. Okay. And then you did a CT scan, right? Lots and lots of polypoid tissue, right? And polyps in the nose is mainly due to allergies. And so everything here points to allergic rhinitis. But I like the way you're thinking through things for sure. Just kind of
I
remember,
low key,
yeah.
I don't know. I think I could have got that I could have got that.
Yeah,
Dang it.
I figured it was in you. I think, but like I said, I think on a test taking strategy, you did it correct, right? If you're like, oh man, I really don't know, cigarette smoking is always a safe bet on step one and step two. That's because cigarette smoking is almost a risk factor for everything in the body known to man, right? All cancers,
Yeah.
right? All inflammation, right? Increase in vascularity, increase of atherosclerosis. The list goes on and on, right? And so cigarette smoking is always a good answer choice if you don't know. But of course, if you kind of dig a little bit deeper here, it just makes more sense that it's allergic rhinitis for this
Yeah.
question. So, but good.